So my name is Graham. I'm a dietitian stroke endoscopist at the Royal London Hospital, and our innovative idea is really a series of medical illustrations. So the evidence would suggest when you meet your doctor, you retain as little as 40% of the information. And a lot of that is due to medical jargon, anxiety, terminology, language barriers. However, if your doctor or your nurse uses an illustration, you retain twice as much of that information. So the app is essentially a catalogue of peer-reviewed medical illustrations. Your clinician can bring up an illustration, whether it be the stomach or the esophagus, and then they can annotate that illustration, write some text, and they can send it directly to the patient. So it makes for a two-way consultation. Patients are more engaged and more likely to ask questions. I think it's very difficult if you're working full-time in the NHS and you're trying to launch, whether it's a start-up or identify a problem and try and tackle it. The NHS Entrepreneur Programme has definitely helped. It can be a very lonely place when you're working part-time on an application. So networking, you'll meet a lot of people who are going through the same journey. They'll share a lot of stories. A lot of them have stumbled before on the path that you're on, and there's definitely people there to help you pick you back up. Have a look at the website. There's a lot of case studies, there's a lot of articles and publications, there's a lot of blogs for people who've been on the programme, who share their ideas, share their experiences. There's a lot of videos, there's a few webinars that give you an idea of the programme and what's involved, and even the application itself really gets you to question, your aims and objectives. If you want to see some change and you're willing to put the work in, the NHS Entrepreneur Programme is definitely for you.